Okay, we're doing part 9 of Prevent and Reverse Kidney Disease by me, Pete Rogers. If you're following along in the book, we're on page 41, figure 114. So here's what I call the Western abdomen. I made up this name for it, the Western abdomen, because basically almost all the patients have the same disease. So typically from eating the high-fat diets, you'll see calcified coronary arteries in the upper image of a coronal CT of the abdomen and pelvis. They'll often have calcifications in their kidneys, sometimes, full-blown kidney stones. A typical patient with a kidney stone, the vast majority of them have a fatty liver. 95% of gallstones are fatty gallstones, cholesterol gallstones, so they'll often have gallstones. They'll often have a little bit of degenerative scoliosis from ischemia, lack of blood flow to the lumbar spine due to atherosclerosis of the abdominal aorta, especially along the posterior wall, causing stenosis, narrowing of the origin of their lumbar arteries. They'll often have calcified iliac arteries and whatnot, and that's called peripheral vascular disease as it goes into both legs. Abdominal pressure syndrome findings kind of like rectal hemorrhoids, varicocele in the scrotum, varicose veins in the legs. All these diseases go together. This is the Western abdomen. Almost all of them are going to have diverticulosis, abdominal pressure syndrome. Okay. Most of them are going to be overweight. And the good thing about knowing this is that the same diet treats all of them. The low-fat, low-sodium vegan diet with no oil, and no sofas, as they say, like Chef AJ likes to say. That's a good quote. No sugar, no oil, no flour, no artificial sweeteners, no soda pop. Okay. And these orange things are the calcifications from atherosclerosis. Okay, so, most kidney failure patients, they die from a heart attack because they get terrible. The worse their kidney failure gets, the more aggressive, the more rapid their atherosclerosis progresses, and they thrombose off an artery. They become real prothrombotic. Dialysis has a tendency to make people prothrombotic. Okay, most Westerners are magnesium depleted. Yeah, and they're low in potassium because they don't eat the plant foods, which give you magnesium and sodium. Once you're in kidney failure, then it becomes more complicated to manage them. Okay. Let's see. Then there's a whole bunch of other kidney toxins. We're not going to get into all this stuff. When you get into stage 4 and 5 of chronic kidney disease, there's these gut toxins like indoxyl sulfate, p-cressyl sulfate. The vascular smooth muscle cells have a tendency to become osteogenic and calcify more rapidly. They have trouble with their phosphates. There's a whole bunch of other stuff I'll go into in the book. It's a little bit too boring to go into, though, during a visual lecture. Here's abdominal pressure syndrome, just a little bit more. So normally, fiber adds water to the stool. It attracts water to the stool, so your bowel movement is more bulky. It's like a cow patty. And the stool being more bulky, it stretches your rectum when it gets down there, and it causes a reflex contraction of the rectum, which evacuates the stool, and it's virtually effortless. However, if the person is eating a high-fat diet, low-fiber diet, like a typical American, their defecation is like goat pellets or hard Tootsie Rolls, and that does not stretch the rectal wall. So when they defecate, they often have to tighten their abdominal muscles. That's called the Valsalva maneuver to generate increased abdominal pressure. That abdominal pressure is transmitted upward. Their stomach, over time, widens the hiatus of the esophagus, esophageal hiatus of the diaphragm, and the stomach will pop into the chest. That's called a hiatal hernia because it pops through the diaphragmatic hiatus. Then they'll get gastroesophageal reflux disease, discomfort, and it irritates the lining of the esophagus. You get what's called a Barrett's esophagus, a metaplasia, increased risk of esophageal cancer. Okay, I like the concept of Chinese sort of hot disease, cold disease. It starts out as a hot disease, acid reflux. Then over time it gets scarred, metaplastic, changes from a columnar epithelium to a squamous epithelium, and then it becomes fibrosed. When it's fibrosed, you can decrease oxygen delivery to the tissues, hypoxia, that can initiate a Warburg effect, injure the mitochondria, cancer. So hot disease, acute inflammation, pain, elevated enzymes, destruction of a tissue. Cold disease is fibrosis, scarring, hypoxia, potential cancer. Okay, it's the same like that all over the place. In the liver, hepatitis, hot disease, acute inflammation of a viral infection, stretches the liver, it's painful, liver enzymes bump up, transaminitis. Over time, chronic scarring, fibrosis, cirrhosis, hypoxia, liver cells, liver cancer. Okay, Warburg effect. Okay, it's like that all over the place. Something similar in the pancreas, etc. in the gut wall, etc. Okay, here's diverticulitis. The back pressure can pop, you leak stool in the belly, very painful diverticulitis. Diverticulosis is just the outpouching. Dry stool on the right side of the colon, and you can form little fecalith stones, appendicolith they're also called. Block the outflow of the mucus secreting glands to the appendix. It pops, appendicitis, okay? Straining, increased abdominal pressure, tendency to get more inguinal hernias, periumbilical hernias. Okay, rectal hernias, varicose veins, varicocele, all that stuff we talked about. So anyways, that's abdominal pressure syndrome. They also have increased incidence of Helicobacter pylori. So all these diseases go together. Instead of thinking of them as one disease, think of these as high-fat diet eaters, okay, especially meat eaters, processed food eaters. This stuff is all super common. You just go on a medical chart, you'll see these diseases all day long, patient after patient after patient, you know. On the internet, everybody's worried about, oh, do I get my good fats? I never seen a fat deficiency ever. In over 30 years of being a doctor, all I see, you could get that with a short gut syndrome. Somebody's had a bunch of bowel surgery for Crohn's disease or something. They're on chronic hyperaldosteronism. But in real life, all day long, I see these diseases. It's like most patients have most of these diseases. Okay. All right, so what I'm trying to say is the same diet that's going to help prevent your kidney failure is also going to help prevent all these other common diseases. So it's going to increase your well-being overall in a big dramatic sense. Why wouldn't you want to do that? Okay, we're going to call it a day at that. Next time we'll come back, we'll start going into sort of the big hot topic of low protein diets. Hope you found that helpful.